Which of the following risk factors is most likely to be responsible for this patient's condition? 77-year-old woman with fever, malaise, and night sweats, recent enlargement of her axillary lymph nodes. She has a history of breast cancer in the right breast 10 years ago, which was treated with radiation and chemotherapy. History is extensive travel to Africa, 30-pack year of smoking. Several axillary lymph nodes are noticed. They are palpable, non-tender, right, in the axilla. And biopsy shows positive NHL. Okay. Now, basically, we just want to know, they want to know which of the following risk factors is most likely responsible. Now, NHL, this is something of a fact that needs to be remembered, but previous radiation therapy predisposes to NHL. Okay. For example, so even in case of Hodgkin's lymphoma, reason is immunocompromised. No, it's not immunocompromised per se, but whenever the patient is being radiation therapy, the nuclear and the DNA structure of a cell is altered, and because lymphocytes are really proliferative, rapidly dividing cells, they are more exposed to the radiation and its effects, and that just leads to mutations and causing non-Hodgkin's lymphoma. Immunocompromise, you'll particularly pay attention to when you are undergoing chemotherapy. Okay. So previous radiation therapy. This even applies. There are many questions related to Hodgkin's lymphoma. They'll come with a patient, a 12-year-old or 14-year-old who had Hodgkin's lymphoma, and it was treated. After 10 to 20 years, that same patient presents with anemia, thrombocytopenia, bleeding gums, and an increase in leukocytosis, right? So what will you suspect in that case is an acute myeloid leukemia or any other leukemia, which basically means that whenever the Hodgkin's lymphoma is treated, it is more prone to developing secondary malignancies in the future. So when we are talking about radiation or chemotherapy and a patient comes with a recurrence, and the recurrence has a picture of neoplasm, it is majority of times because of the treatment that he or she received for the previous malignancy. Okay. Yeah, travel to Africa has nothing to do with NHL. It can lead to, we'll come to that, but it can lead to Burkitt's lymphoma, but that needs a prolonged stay in the endemic region. Axillary lymph node involvement has nothing to do with NHL. It could be metastatic breast cancer, also recurrence. Female gender has nothing to do, and breast cancer diagnosis has nothing to do with NHL. It has to do with axillary lymphadenopathy if it is a metastasized recurrence of the disease, cancer. Okay.
Thanks for watching. Please give a thumbs up and subscribe for more.